I'm Freddie Lim from the union. First, I'd like to comment about this Medishield that's going to be enhanced. There are three things I want to talk about. First is that, instead of moving from 85 years old to cover until 90 years old, why don't cover lifetime? Because 90 years old is already very long. And how many more people can live beyond 90? So it will look good for everybody if you say the Medishield coverage will be for lifetime coverage. Second thing is that when you enhance the Medishield, I know that the premium will have to be increased. But I feel that we should still allow them to be covered. Their pre-existing illness should be covered. If you want to enhance the shield to make it better, we should also look at whether you want to consider covering the pre-existing illness. Otherwise, a lot of them, they'll find it not worthwhile to sign up for the enhanced shield when you have to pay a higher premium, and yet your pre-existing illness will be excluded. Okay? And the third thing is that I hope that the Medisave, the use of the Medisave, the cap at $800 should be raised in view of this changing premium and so on, from $800 to $1,000. Now the cap is at $800. And I know in some cases when you reach a certain age, let's say you reach at 70 years old, the premium is in some cases $802. So the $2 they have to pay in cash, and the $800 from the from the Medisave account. So my suggestion is to move the cap, raise the cap to $1,000. We have to look long term, rather than making changes from time to time.
Medishield, let me say that when we were looking into reviewing Medishield and looking at extending the coverage from 85 to 90, of course we also thought about, should we also increase it, like you say, lifetime. But we always have to balance between, when you increase coverage, premium increase. And we always have to balance between affordability, ensuring that it is an amount that people won't opt out of, right? That your premium is reasonable and it will not cause people to opt out. Now our Medishield coverage is an opt-out system. Most people are covered. I think most people have taken up. The dropout rate is very, very low, if not significant, and that's because we have made it such that Medishield is for basic coverage of basic but large size hospitalization bills. So it's reasonable. Therefore, people don't opt out. If you increase coverage, of course, premium will go up, right? So our idea is that 90, like you say, most people don't live beyond that. The average life expectancy has not gone across 90. Of course, there are people who live beyond 90, and I've seen in many of the daycare centers and nursing homes now you go, it's easy to find even 100 years old, right? You are right. So this is something that we have to continue to review. But what I would say at this point is that if somebody is not covered after 90 and he or she is not able to afford his or her medical bill, there is Medifund. Medifund can kick in. So it's not like there is nothing beyond that you can resort to. I think we are committed to ensuring that people will have access to health care. And if they cannot afford, the government will come in. In fact, our financing framework, our funding model for healthcare is, there's individual responsibility, of course, the 3M, right? Medisave, Medishield, Medifund, last resort. But actually, a significant amount of the healthcare cost is borne by the government through very significant subsidies. If you go to Class C, B2 ward, you are heavily subsidized. Even at the polyclinics, you are heavily subsidized. And recently, we implemented this new enhanced community health assist scheme, CHAS, where the income criteria is now raised to 1,500 per capita household income. So really you cover not just the low income, but up to the middle income now. And they can get subsidized healthcare at private GPs as well as dental clinics, right? So increasingly, I mean, even the 3M framework we will be reviewing. We have announced that we are looking into reviewing Medishield. One of the things we are looking at is whether we should cover congenital disease, right? And we are going to take feedback on that. So we will be reviewing it. But we always need to be mindful that we have to balance, what Medishield can cover versus what is affordable to most people, because this is a plan, insurance plan that we aim to cover everybody, in Singapore. And therefore, we need to continue to see how we can balance this and still ensure that you'll be covered. And like I say, last resort is Medifund. And that's why we have topped up Medifund, $600 million, because then we can give more help to those who need the assistance.